Hey everyone, welcome back to A Second Chance. My name is Philip Jones, your host, kidney transplant recipient, and today I'm here with Lindsay Ducharme. Lindsay, go ahead and introduce yourself for a second.
Hi, I'm Lindsay, and I'm a kidney dietitian. I have a private practice called Vital Kidney Nutrition, where I help educate people on how to manage their kidney disease using plant-based nutrition. So I have a presentation. I'm going to be talking today about preventing and treating gout with when people have chronic kidney disease. So gout and CKD often go hand in hand. Many people with kidney disease do uh, have issues with gout. So that is why I think it's really important to talk about. So, what exactly is gout? So, gout has actually been around for ages. It's actually one of the oldest diseases. It's been around since the times of ancient Egypt. Um, but it's caused by an accumulation of uric acid crystals in the joints. So it usually affects one joint at a time. Many people experience it first in their big toe, but it can occur in many different joints in your body. So these uric acid crystals cause a lot of pain and inflammation. So people with gout, they're very, this is a very painful condition. So being able to manage it really can improve people's quality of life. So where does this uric acid come from? So uric acid, it's a waste product that comes from it actually comes, it's made by our body, and it also comes from food. So it's created from something called a purine. So purines come from our diet, and then purines also come from our body. So, we're going to have some uric acid in our blood, but when someone has kidney disease, they can sometimes get a buildup of uric acid because maybe the kidneys aren't getting rid of enough uric acid. Um, so let's talk about. Let's see. So let's talk about diet and gout. So there are some diet patterns that can trigger gout. So some people may have been told to follow a low purine diet. So, because as I had mentioned, that purines, when your body metabolizes these, they turn into uric acid. So, it may make sense, if I have gout, I just need to limit my purines. The problem is purines they're in everything. There are foods that are going to be higher in protein, higher in purines, and then there are food that are going to be lower in purines. So the foods that you want to limit with gout that are higher in purines are a lot of animal foods. So things like beef, red meat, seafood. These animal products tend to be higher in terms of purine content, and they're more associated with gout flares. So that is one thing you can target to help prevent gout is not overdoing it with the meat and the seafood. So there are purines even in plant foods like vegetables, beans, soy, but studies are mixed on if these plant foods actually cause the high uric acid levels. Plant foods have a lot of vitamins and minerals, and some of these vitamins may actually help prevent high uric acid. So, really, and if you look online at a low purine diet, some of them do recommend limiting certain fruits or vegetables, but the research is mixed if this is actually going to make a difference. But we do know that the animal proteins, like the meat and the seafood, are definitely linked to higher uric acid and gout flares. So another definite trigger in the diet for gout is high fructose corn syrup. So high fructose corn syrup, it's added to a lot of different beverages and foods. So things like juices, sodas, any of these drinks may have high fructose corn syrup. High fructose corn syrup is even added to seemingly healthy foods like Mott's applesauce. There is high fructose corn syrup in there. So whenever you're buying anything that is packaged, you always want to look at the ingredient list. So you want to kind of scan through and see if there is high fructose corn syrup, because that has definitely been linked to an increase in uric acid. So some other things that may have high fructose corn syrup, it's often found in different condiments like ketchup, relish. It's in salad dressing, of course, like your snack bars and things like that. So it's really everywhere, but it's limiting it can definitely help you, so you're less likely to get a gout flare. So another really big trigger for gout in the diet is alcohol. So especially things like beer has been shown to cause increase of uric acid in the body. So it's definitely recommended to try and limit alcohol when you have gout. So some people, they may have individual dietary triggers. So, maybe some food you notice, every time I eat this food, like I feel like I'm getting, if you get pain in your joints. So, sometimes it's individual and you kind of have to just pay attention to your symptoms and try and think about, is there a pattern? Does this food trigger a gout flare in me? Because gout can be a little bit tricky, but definitely they've done many studies that show definitely, the very high meat diet, high seafood diet, and the high fructose corn syrup and the alcohol, those are definitely the main triggers. So there are some studies that have shown certain foods may actually help reduce uric acid and may help prevent gout flares in people that are predisposed to gout. So one of these things is cherries. So they've done a couple studies showing that specifically tart cherry juice can actually reduce uric acid levels. So when we reduce uric acid, we're reducing the risk of developing a flare. So I believe the study, they had participants take maybe 2 to 3 ounces of tart cherry juice a day. So they're not exactly sure why this helps lower the uric acid. It could be some sort of like antioxidant in the cherry or the vitamin C content. But that's definitely like a relatively safe thing that people with kidney disease can add into their diet if they are trying to, lower their uric acid. Because it's not, it's not adding a ton of potassium or anything. So that could be something that you could try. So another study actually showed that coffee may also decrease uric acid levels, which was interesting. Of course, if you're drinking coffee and needing to add a lot of like sugar and things, that may not be as beneficial, but the coffee itself, a study had shown that it did decrease uric acid levels. So another thing that can be helpful in preventing gout is dairy. So for some reason, having adequate dairy in your diet can be protective. So it's a good idea to maybe, depending on your other restrictions, add in things like yogurt or some milk. That could be beneficial. And another type of eating pattern that can help with gout is having more of an alkaline diet. So an alkaline diet, in order for your diet to be alkaline, that is a diet that is rich in plant foods like fruits and vegetables, whole grains, nuts, and beans. So all these plant foods tend to be more alkaline in nature. So, and you want to do less of the acid forming foods, like things like meat, for example, and seafood. Those are more on the acidic scale. So yes, studies have shown that so more of a plant-based diet is very protective for gout. So that's another thing you can consider. And a plant-based diet is definitely good for people who are trying to preserve their kidney function. So you're kind of helping your kidney function and reducing your risk of gout, with the same type of diet. So another thing to consider with gout is you want to be well hydrated. So being dehydrated, they have found, may trigger gout. So it's a good idea, so for most people, to figure out how much fluid you need a day. A good estimation is taking half your body weight, and then that's how many ounces. So for instance, if you are 150 pounds, divided by 2, that's 75. So you'd want to have about 75 ounces of fluid a day. And obviously water is going to be the best fluid of choice because, like I said, if you're drinking a lot of juices and sodas, those may have the high fructose corn syrup, which is not good for gout. So water is always going to be a safe bet. If you don't like to drink plain water, you could try and add lemon to it, or some lime, or if you really want to have some, if you're a person who just can't stand the taste of water, even if you do like 100% juice, like 100% grape juice or apple juice, and you can even like dilute it with some water, so that way you're getting the flavor of juice, but it's like not as much sugar. So that's an idea to kind of help you get some more fluid in. But when it comes to gout, I mean, it's not only, having gout flares is not only affecting the quality of life of some people, but when your uric acid levels are consistently high, that may be associated with kidney disease and, potentially declining of kidney function, because when your uric acid level is too high, I mean, that's a waste product. So, it's not good for the kidneys. So it's definitely, really important to address. And if you're someone, your uric acid level is high, you don't have any gout symptoms, you definitely want to address that, before you develop any symptoms. So, so in conclusion, so when it comes to gout, I mean, you can definitely take a preventative role with the foods you're eating. So by making sure your diet is not high in the animal proteins, especially red meat and seafood. So that can help protect you. In terms of high fructose corn syrup, making sure you're trying to eliminate that from your diet, which would involve reading food labels, checking ingredient lists for high fructose corn syrup, trying to cut back or avoid alcohol. So those are the main foods that you want to stay away from or limit. And then foods that you're trying to encourage, definitely more of a plant-based diet. So, instead of getting your protein from animal foods, try getting it from things like beans and nuts. Having plenty of fruits and vegetables in your diet. These are things that can, protect not only your kidneys, but your risk of having a gout flare. For people that are already doing plant-based, you could try, the tart cherry juice, which has been shown in studies to reduce uric acid. And always, working with a dietitian who specializes in kidney function can help you make some good diet changes that will work with you and your lifestyle and your food preferences. But definitely, there are things that you could do proactively when it comes to gout. Okay, so I hope that was helpful.
Awesome, awesome. Thank you, Lindsay. Before I get into my questions, we'll take a quick commercial and we'll be right back.
Have you been diagnosed with chronic kidney disease? Are you confused on what you can eat? Are you worried about your kidney function getting worse? Well, give this a listen. I'm Lindsay. I'm a registered dietitian and board certified specialist in renal nutrition. And I started my private practice, Vital Kidney Nutrition, to help educate and empower those with chronic kidney disease to use plant-focused nutrition to take a proactive approach in managing their chronic kidney disease. I use an individualized approach based on a person's lab results, their nutrition status. I take into account the cause of kidney disease and, most importantly, your food preferences. Because let's be real, if we're not liking the food we're eating, then it's hard to stick to a nutrition plan. My private practice is 100% virtual, so you get to receive nutrition counseling from the comfort of your own home. I'm also contracted with several major insurance companies. To learn more about me and how to work together, check out my website, www.vitalkidneynutrition.com. Hope to hear from you.
Okay, and we're back here on the second chance. So my first question for you, Lindsay, is so you named a lot of purine foods as animal-based foods. What substitutes do you recommend people put in place of those foods?
Good question. Yeah. So, instead of using like things like chicken and beef, like I like to use a lot of different beans, chickpeas, lentils. Like, for instance, like if you were to do like fajitas one night, instead of having chicken, you could do like black beans and make some sort of like black bean taco. That goes really good. So they do have there's a lot of different like meat substitutes on the market, like things like Beyond Burger and like those vegan chicken products. With things like that, you sometimes have to be careful. You have to look at the ingredients. They may contain high fructose corn syrup, which could kind of defeat the purpose of switching. And they may not have as much benefits as like the whole plant proteins like beans and things like that. Um, but I mean, there's a lot of other ways you can have meals without meat. Like think of just familiar dishes that you already make at home, like things like pasta dishes. It's very easy to make that without meat. Things like stir fries. You could do like even tofu if you're open to that, or like adding peas to it. Peas are a higher protein vegetable. But a lot of people, once they think about it, they do come to realize like, oh, I do, make a few meals that I could easily, replace the meat for beans or something else.
Awesome, awesome. So, when my next question is, when someone already has gout, what nutritional way do you suggest they go to get rid of it or lessen it? Is it the same as kind of the same answer of the question I just gave, or is it a different route that you take them in?
Yeah, so it depends on the person and like what changes that they've already made. But I mean, a lot of people, they may already be doing a lot of these things. Like maybe, especially someone with CKD, they may already know like, oh, I can't have a lot of animal protein. So maybe, they have reduced that already. Maybe, they're not drinking alcohol. But I mean, there's a lot that goes into gout. I mean, so for uric acid, like your kidneys do get rid of some uric acid, and then you actually get rid of some through your bowels. So trying to make sure, you're trying to make sure your body's eliminating as much uric acid as it can. So sometimes we may need to target like gut health. Like maybe the person's dealing with constipation, they're not, eliminating some of the uric acid that's that way. So trying to work on their gut health, making sure, they may need a little bit more fiber. Maybe they're not drinking enough fluid. So you kind of have to like check all the boxes in terms of gut health too. Um, and yeah, sometimes just, including some of these foods that have been shown in studies to help with uric acid, like, the cherry juice. That's a pretty easy one to add to see if that does anything.
Great, great. So basically, a lot of shelf life foods you name can cause gout. Which shelf life foods do you recommend people on dialysis store in their emergency kits? That's one thing that I know is, our dialysis units and stuff, they urge us to keep, emergency kits, shelf life foods in there, and,
Mm-hmm.
water and stuff like that. For somebody that's going through gout or has a history with it, what shelf life foods do you recommend that they keep in them in there to be able to sustain them if they, power goes out for 2 or 3 days, or
Yeah.
something happens?
Yeah. I know we used to give out when I worked in dialysis. I remember giving out the emergency meal plan every year. And, things like for protein, tuna fish is on there. So of course, like you don't want to have a lot of tuna fish with gout. Um, so you could also do like chickpeas. That's a very easy one to keep on hand. You can mash up chickpeas as a sandwich. And I know mayonnaise is usually on the list too. So you just want to compare brands and make sure I don't think mayonnaise is a huge one for the high fructose corn syrup, but just making sure you're choosing a brand that doesn't have high fructose corn syrup. With the canned fruit, that's good to have on hand. And you want to choose a canned fruit that is made with 100% juice. Or you could buy, instead of regular applesauce, if you choose one that is unsweetened, um, that will not have the added high fructose corn syrup. Um, yeah, but if you have, cereal is usually one that you want to keep on hand. And again, just trying to look, you kind of have to compare, different brands, see which one isn't going to have the high fructose corn syrup. Yeah, but those are, some options that we used to tell my dialysis center patients to keep on hand.
Yeah, so just I want to add something to that since we're talking about shelf life foods, is that the one thing that people don't understand is just because they're called shelf life foods that they don't have an expiration date. They expire at some point.
Mm-hmm.
So every year or so, you should be going through that emergency pack and checking to see what's expired or what's getting ready to expire. What has another year or so on it, so you'll know when you need to come back and switch those things out, so you don't think in your mind, okay, I'm good. If anything happens and something happened, and you look and you only really have like half of what you stored because you never changed stuff out. So that's very important when it comes to emergency packs for dialysis patients.
Mm-hmm.
Um, so when it comes to cherry juice, would you recommend somebody making their own cherry juice or doing store bought, or does it even matter?
I would probably do store bought because I would imagine like you'd probably need a lot of cherries to make this. But for some reason, there's different cherry juices, but the one you want, it should say tart cherry juice. So they use probably a different kind of cherry. Maybe it's like more potent in antioxidants or vitamins. But I've seen it in my regular grocery store, and it's very concentrated. So I think I don't think it's something you can make at home, but you can actually. They did in one study have people eat cherries. I'm not exactly sure how much, but I would say even including cherries in your diet may be beneficial. So if you want to, but they're not always in season. So but they do have like frozen cherries that you could always buy. But including a serving of cherries a day, it's definitely not going to do any harm. So, you might as well try it if you're someone who deals with gout and you're trying to find some relief.
Right, right. So what's too much dairy in your diet but enough to prevent gout?
So I would say, I mean, most people, they probably want to aim for maybe 2 to 3 servings a day. That's the general amount to meet your calcium needs. So,
Mm,
I mean, this is going to probably vary person to person depending on, um, especially someone on dialysis, if they do have high phosphorus, you know, that could make their phosphorus harder to control if they're eating more dairy. But um, most people, like a serving of dairy, it's a piece of cheese or 4 ounces of milk. So it's not like you need to be drinking multiple cups of milk a day to get your calcium. And if your phosphorus is high, just making sure you're taking your binder with these foods. I'm not exactly sure if it said an amount in the study, but I know that people that are eating dairy regularly, it can be protective against gout.
Wow, that's honestly something I would have never thought possible. I've dealt with gout before, and it was usually because I had too much dairy in my system. Why it caused it, and like you stated before, it starts with your big toe, and
Mm.
even the slightest touch of it, is painful. I remember I had it when I was in the hospital, and just adjusting to sit up in the bed, and the cover rubbing against it was like, okay, this is painful.
Ugh,
I'm
yeah.
done with this. So, yeah. So this is my last question. How much water is enough water without a dialysis patient going fluid overload?
So, I mean, for people on dialysis, this is the tricky part because, well, if you're on dialysis, you're usually restricted in fluids
Right.
to about like a liter, um, and maybe a little bit more if you have good urine output. So, I mean, that's kind of tricky because people that are on dialysis, you definitely don't want to be drinking more water. So you probably want to focus on other dietary factors to prevent gout. But for people with kidney disease not on dialysis, if you feel like, if your doctor has told you, you may be at risk for fluid overload, like say you're stage 4 or 5, and you do deal with swelling, you'd want to ask your doctor what is safe. But for a lot of people with CKD, they don't need to follow a fluid restriction. But it's more about avoiding dehydration than anything. Because dehydration is definitely a trigger. So, to be well hydrated, like, most people, if they're drinking 2 liters of water, that's going to meet their fluid needs. And, you could tell by when you urinate, like, if you pay attention to the color, like if your urine is very concentrated, then that might be a sign like, oh, I'm a little dehydrated, and you should drink a little bit more.
Awesome, awesome. Well, Lindsay, thank you very much for all this valuable information. Greatly appreciate you. It is the month of April, which is Donate Life Month. So please talk to your family, your friends, your neighbors, people in your neighborhood about going to register to be an organ donor because it's very imperative that we get as many people signed up as possible. And I'm not just saying to go sign up as a living donor. I'm just saying just go sign up in general to be a donor because you can't do anything with these organs when you leave here. So you might as well pass them on to someone to keep them going or give them a chance to keep living. Um, I was blessed with that chance at 17 years old. Somebody, unfortunately they lost their life, but it gained me life. So definitely grateful for my donor and that person's family. Never had a chance to meet their family, but wherever they are, I hope they're doing well and able to cope with their loss. Um, so some things we have coming up on a second chance. We'll definitely be announcing a new conference coming up after probably later in the month. We just got done with our FSGS conference, so um, that was great. So um, we'll see you all back here, and have a great and wonderful day. Thank you, Lindsay.
Thank you.